Which diet is the best diet out there for health, for losing weight, just in general? What's the best diet to eat? That's a common question that I hear, and the answer is it depends on the person. And I know you may be frustrated by that by now, but today's video is going to show you cases where that has been applicable and the right diet for the right person has made all the difference. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Is paleo the best? What about the keto diet? What about being vegan or vegetarian, or the autoimmune paleo diet, or avoiding lectins, or the Atkins diet? What's the best diet? Again, it depends on the person and their unique combination of contributing factors to their health challenges. Each of these diets in general would probably be helpful for the majority of the population, but on an individual level, each of these diets can hurt somebody depending on the individual. Also, each of these diets may help an individual improve, but may not be the correct diet for that specific individual to reach optimal. So this nuance is very important in taking a person from just sick to better. That's the difference between sick to better and sick to life at optimal. My goal is to help you reach a life at optimal. So check out the rest of today's video, which is a portion of a speaking engagement I had recently, where I'm taking you through 3 case studies of people in my office where I used 3 different diets specific to the person we're discussing to take them to optimal. Enjoy. I'd like to show you cases from my office that we use specific diets to as a part of their action plan to deal with their complaints. So we'll start with Blake. And Blake, when she came in, was 4 years old. Now she's pushing 6. And her complaints were eczema, worse on her hands and feet. So her hands and feet looked like elephant skin. It was very rough, swollen, and cracked. So it would bleed and be very painful for her. And her torso would be like hives and really red and swollen. And she had whole body staph infections. Okay, so the things that pediatricians would recommend, and dermatologists, where she'd have to do these bleach baths, try and basically bleach or kill the staph that way. It's probably not going to help the skin though, right? At least short term. She's got many food allergies, as we will see: sinus infections, stomach aches, ear pain, and throat pain. So very uncomfortable 4-year-old girl, and not anything any of us would wish for a 4-year-old girl. So she saw her pediatrician, and they ran a food allergy panel. And she had the yellows are her lab highs. So she reacted to egg whites, wheat, walnuts from a food perspective, and dog dander from an environmental allergen perspective. So one thing to understand is, you can see here total IgE. So they tested IgE allergies. From an immunology standpoint, IgE is the EpiPen response. Okay, so it's that anaphylactic acute hypersensitivity response. So maybe, she eats wheat and lips swell, throat swells, need EpiPen, for example. So knowing that, would you give your daughter this stuff? No. Well, the pediatrician says, you can still eat it, you'll outgrow it. Okay? with a kid in front of them with elephant hands and feet and all this red swelling stuff. So that's one of those like Homer Simpson dough moments, like, come on, man, use your medical education. And has anyone had a family member or friend told the same thing? In the last group, there was a person. And so what you need to understand is, saying that they'll outgrow it basically, is evidence of a poor understanding of immunology and the mechanism, because this is an immune reaction. So the immune response is not related to her age. Okay, so whether she's 4, 6, 9, the person in the other group, they knew a 19-year-old that was told they'd outgrow it and still hadn't. So what's going on is, if the immune system is a symphony, we'll use a symphony metaphor, you'll have the conductor on the stool here telling them when to play, and you have, saxophones over here, you have stringed instruments over here, you have flutes over here, percussion probably. So the different types of cells in the immune system make up the different instruments, and then the conductor is the T regulatory cell, or the one that says, hey, play or don't play, louder, quieter, that sort of thing. So has anyone been to a show, a symphony, an orchestra? So you went expecting a good show or something worth your money, right? Good. So if the conductor had stayed out late the night before and drunk and fell off his stool, how good would the show have been? After like you laughed about that part, you probably want your money back. Well, same thing happens immunologically. If this guy falls off his stool, then the specific, artists or instruments know what they're supposed to play, but they may not necessarily know what and when everyone else is supposed to play. So we can have polarization, or we could have, say, the stringed instruments playing too loud and too much, and the sax playing too little and not enough. And so from an immune standpoint, the Th2 cells deal with allergy and parasites. And the allergies involved with, you could be skin, could be asthma, could be any sort of atopic reaction. Th1 cells deal with pathogens or infection. And Th1 and Th2 oppose each other. So if we go way high here, then we have inhibition over here. Okay? So you may know people who are just like Blake, kind of dripping with allergies, sinuses, skin stuff, asthma, and they're always sick too. Well, the reason for that is this response is inhibiting this response. So they're always inflamed, asthmatic skin stuff, and they're also very bad at fighting any infection that they're exposed to. Okay? So this is an immune thing you're not going to grow out of. This is a tilt or a shift, or the pendulum swung too far towards the Th2 dominance in this person. Saying you're going to grow out of it isn't going to occur. You have to actually go address the immune system, partially by waking this guy up and putting him back on his stool, so you can start from the top and go from there. Okay? Make sense? So here's pictures from pre, so when she walked in. So hopefully you can see it, but how red this is. You can see some hives and stuff, and then around her belly button there, you can see it as well. So, and then her hands and feet, I didn't put pictures up there, but the elephant skin and cracking and pain on the hands and feet. So it's so bad that if she walks out in a morning like today where there was dew on the ground, she walked out barefoot, her feet, she'd get acute inflammation and be triggered by just environmental pollens and grasses and stuff. So we need to, there's a couple ways you could treat this, right? Say the pediatrician actually told her, don't eat those things. That would be a good start. But then they would probably also maybe give her antihistamines, maybe steroid injections, that sort of thing to help with the inflammation. That's one way to do it. But antihistamine, all you're doing is kind of quieting the symptoms of this. Steroid shot, you're quieting the symptoms of this. You're not addressing the cause, right? So we need to go find what's the cause of this immune imbalance, pull that out, and then we can create balance here, okay? So with lab testing, we can look under the hood and say, what's going on with Blake? Why is she so, allergic? And address what we find. So this is a stool test, and what you see here, the green are probiotics. That's our good guys, okay? Yellow are called commensal, which means they could be good or bad depending on the context or the overall environment in the gut. And then red are always bad guys. So my analogy is, if you think back to Charlotte during the election, there's some unrest down there. And my analogy is the yellows are probably are us. We're good innately, right? But if we're down in Charlotte at that time and there's a red guy there throwing a brick through a window, we wouldn't necessarily be the first to throw the brick, but after he threw one, the environment might be such that it seems exciting to throw a brick, and there's a little piece still hanging up there that I could probably hit, right? So you're not a bad person by nature, but you can be influenced. Oh, nice. So brick throwers drive lots of inflammation, okay? And inflammation exacerbates this stuff. You might say, or did anyone think, why did he do a stool test when she had the skin issue? Anyone think that? Yeah?
I guess so.
Yeah. Well, yeah. So, but why?
I mean, that's the fuel that runs the body.
Mm-hmm.
Cells, inflammatory.
Yeah. Good. And and piggybacking on that, up to 80% of your immune system's in your gut. Okay. So if you have a leaky gut or a trashed gut, then more is getting through than should, and now you're pulling this fire alarm all the time. So you're driving inflammation all the time. So if her gut's trashed and it's constantly being triggered, then we have guts feeding the rest of the body, right? So there's a gut-skin axis. So if your gut's trashed, skin is a detox organ, it's going to manifest that way. So we have brick throwers, and then these are yeast or fungus overgrowth. It's not normal to have anything there, so don't worry about that being normal. It's abnormal. So she had rotatorula overgrowth. So Enterobacter and rotatorula, both of those are causally associated with psoriasis. Okay, so she has known eczema and skin reactions, and she has the microbes that may be driving her immunologically toward an autoimmune skin disorder like psoriasis. So we don't want that for our 4-year-old friend. And then lysozyme, lab high, that's showing just another marker of big time immune response in the gut. And then eosinophils here, I should have highlighted for you, 7.1. That's functionally high. That's way higher than we want to see. And eosinophils are cells in the Th2 that respond to allergy and or parasites. From a blood work perspective, her blood sugar was way too low. Her insulin was lab low, and then another inflammatory marker, uric acid, was lab high. If anyone knows someone with gout, uric acid is a big time driver of gout. Okay, and then her iron levels were low. So if we're low in blood sugar and low in iron, which carries oxygen, and oxygen becomes energy, we're low in blood sugar and iron, we're low in the ability to produce energy. So as you mentioned back there, the cells need energy, and if we're trying to heal from something, we need more energy, right? So she's got massive inflammation going on and poor ability to create energy. So what are we going to do for her? What would you do for her? No, there's no wrong answer. She's got one, right?
Take her to you.
Not a dumb answer. You're right, but they did that already. So help me create her action plan.
First you need iron, right?
So,
You give her iron?
maybe. Spinach, maybe. Just don't even be a doctor right now. Just say if something's low, you should probably raise it, right? And if something's high, maybe lower it, right? So blood sugar, she probably needs fuel, right? So we want to normalize blood sugar for her. Iron could be a consideration, but if we gave her iron and left her gut leaky, she's just losing it, right? So what if we healed her gut and didn't give her iron, and then after we think her gut's healed, retest iron and see if it's come up. And then if it hasn't, we never have to give her iron, right? And that way there's one less pill she has to swallow and that sort of thing. Good. So here's what we did. First, we want to remove the foods that she tested EpiPen for, right? So that was the wheat, the eggs, and the walnuts. And then dogs, try and avoid dogs as much as we can. They happen to have dogs. We also, sorry?
Smart remark.
We also added elimination of gluten, dairy, and soy in there because those are known pro-inflammatory triggers. With the low blood sugar, we wanted to make sure she's getting enough calories and enough fats, okay? So if you're in a coma on a bed, you have a basal metabolic rate and a requirement for a certain amount of calories every single day. If you're not meeting that, you're catabolic or breaking down. So if you're breaking down and trying to heal, that's not a good mix. So we want to give her enough fuel to be able to heal. Rid the dysbiosis is fancy for get rid of the bad bugs, the brick throwers, improve her probiotics, and support immune phenotype. So phenotype's fancy for, you know, which way the pendulum swung. So we want to balance this out. So this was a video that we can't get to play on the PowerPoint for some reason, but on my YouTube channel, if you want to see her testimonial, you can check it out, or on my website under testimonials. There's hours of fun there. You can find hers. But the red tells you what you need to know. Within 3 weeks, her skin was smooth to the touch for the first time in 4 years, basically the first time in her life. Okay? And so how life-changing is that for a little girl? How life-changing is that for the mom who doesn't have to give her bleach baths, you know, multiple nights a week? And, you know, what I didn't tell you is, you know what bag balm is? Or a badger balm? Those. So, I mean, they had that in every purse and everything, always around them, because she had to keep it on her hands and feet to keep them from being raw. So big time quality of life change and big time change in the skin. So, you know, a dermatologist, even if they honored the IgE reactions, would not have ever looked at the gut, right? And the GP probably wouldn't have either. So they would forever get topicals and antibiotics and steroid shots instead of addressing the cause. And now she can, you know, go outside and play without dew on the grass setting her off. Any questions on that? No? Okay, let's go. So now we'll move on to 45-year-old female, type 2 diabetic. SIBO is small intestinal bacterial overgrowth, so gas, bloating, maybe diarrhea, constipation, gut infection. She has reflux, she has chronic pain and fatigue, which some have called fibromyalgia, and sleep apnea. So when she first came into the office, those are her 8 medications she was on. As a type 2 diabetic, metformin is the #1 most common drug they'll be put on. Invokana is another common one. Progesterone, she's perimenopausal, so she's having some hormone fluctuations. Her doctor has her on progesterone. The Pepsid and the Zyrtec are for allergy, or I'm sorry, the Pepsid for reflux, the Zyrtec and Mucinex for allergy, and the sertraline is antidepressant. She, she just moved from St. Louis before she came in, okay? And so St. Louis is where Monsanto is located, and Monsanto is our big-time GMO producer. So many studies have shown that consumption of GMO drives physiologic change that can look like type 2 diabetes or metabolic syndrome. So high blood sugar, cholesterol levels off, stomach issues, all of that. So knowing this person and realizing, hey, she just came from GMO Central, maybe this has been at play in driving her dysfunction. Look at that supplement list. She would get a gold star from Dr. Oz, because that's like everything he's ever talked about. Is that someone's had doing this? Like, because they're marketed like, hey, this is the wonder supplement. You take this, it takes care of all that. Well, she's taken them all, and she's still got, you know, this list of issues, plus 8 drugs. So the point of putting that on there is to say that there's no magic bullet, whether we're talking about a drug or we're talking about fish oil or turmeric. The magic bullet is finding the cause, and then we can use things like supplements to help us address the cause. But ultimately, even if you take all of Dr. Oz's favorite supplements but still choose the donut, you know, where are you going to get with that, right? So she chooses, at least at this point in her life, donuts were the choice, okay? Other things contributing to her health or lack of health, lots of antibiotics in her life. Antibiotics trash the gut, making fire alarm easier to pull and chronically pulled, okay? Poor nutrition, she's type 2 diabetic. By definition, she has lived her way into that. She has chosen that. She's chosen donut enough to actually get a diagnosis. She just moved from St. Louis. She loves diet soda. Big time sugar, or not necessarily sugar, but the neurotoxins in diet soda are big time going to imbalance physiology. she's physically inactive, and then she has the mental component or the emotional component. So she's tried multiple times to lose weight, tried to pick apple and failed, and so she doesn't believe that she can ever pick apple or succeed, right? So we have to remember that there's the psychosocial aspect in every person, and that's a big factor in the case sometimes. So I said, you can do it, right? And we have to get her to believe that. So here are her initial labs. So lipid panel or cholesterol, 289, triglycerides, 309. When triglycerides approximate or pass your total cholesterol, you have metabolic syndrome, okay, which can become diabetes and other things. So we already know she has type 2 diabetes. C-reactive protein is like the inflammatory marker that our medical doctors use to say you're inflamed, and it's also a dependent risk factor for heart disease and stroke. Fasting glucose, what should the number be? Anyone know? It should be 80 to 90 is optimal. Hers is 312. Okay? Diabetic. If you didn't think so, you're diabetic. For A1C, so fasting glucose is right when the needle stuck you. That's like a Polaroid picture. Okay? The A1C is your average over the last 90 to 120 days. That's more like a video. Okay? And so a video gives us a lot more information. Her A1C lab high at 9.6. We'd like it to be 5.4 in a healthy individual. Her ALT, that's a liver enzyme, that's lab high, so she's developing non-alcoholic fatty liver disease because of her type 2 diabetes. Her TSH is lab high at 4.8. That's thyroid stimulating hormone. That's diagnostic for hypothyroidism. So, you know, that's going to be fatigue, hair, skin, and nails unhealthy, can't lose weight, constipation, brain fog, diarrhea, that sort of thing. And then her urinalysis shows a UTI and glucose in her urine. We also looked at her stress levels because of the psycho-emotional aspect, plus moving cross-country and all of that. And so cortisol is your stress hormone. If cortisol is high, cortisol can also lead to fat deposition around the waist because cortisol liberates stored sugar into the bloodstream. So actually, stress will increase your blood sugar. So the black lines, this is a 24-hour collection. So it's showing her 24-hour rhythm, how it should look. All of ours should look like this, the black line. The red should be in between the black lines somewhere. So you can see how hers is actually reversed from what it should be. So she's going to wake feeling unrested, be terrible at getting out of bed and getting going in the morning, have a little bump in the afternoon, and then at night could be wishy-washy. So another thing to know is cortisol is one of our best anti-inflammatories, right? If you have an injury and you're really inflamed, you might get a corticosteroid injection. Well, we make our own, and so we have an endogenous anti-inflammatory in cortisol. Well, if hers is low, that could lead to the chronic pain, fibromyalgia type complaint she has. And then her stool test, brick thrower over there, Klebsiella, associated with interfering with the liver's ability to detoxify things. So detoxing her hormones, her toxins, her GMOs, all that. And secretory IgA is lab low. That's the first line of defense in the gut. So if that's lab low, we're breaking through easier and pulling that fire alarm, driving inflammation. So what would you guys do for? What diet would you give her? It can't be worse than what she's doing. Right? How about apples? Good. Good job. All right. So we used for her a modified ketogenic diet. Okay. So with Blake, we removed triggers. With her, we gave her a specific diet. With her, we gave her modified ketogenic. So ketogenic is 90% fat, really hard to do. Modified is not that high of fat, but we want to keep you in a mild ketosis. It's low carb, so we're not triggering her blood sugar. So we put her on that. We eliminated soy and grains, and then we had her eat only 3 meals a day. So there's this conversation of should I eat 3 meals a day or 6 meals per day? You know, especially if you're in exercise, bodybuilding, that's a common question. If you're eating 6 meals a day, blood sugar's staying higher, insulin's never returning to baseline, okay? So for her, with type 2 diabetes and insulin issues, we want her to eat 3 meals and then fast, no snacks, lots of space between those meals so that insulin and blood sugar can return to baseline or as close to it as possible. And portion control. So, you know, with the stress levels and the psycho-emotional aspect, you know, she would stress eat. So, you know, it's easy to blow through the portion control if you're stress eating. At the same time, there were iron, liver, and thyroid issues, as you saw in the labs, that need to be addressed. So the diet was one piece of the puzzle. And we want to go back and see her labs. So this side is initial, other side is at 6 weeks. So you can see that triglycerides have come down from 309 to 275, total cholesterol from 289 to 217. So, you know, the fervor with which the medical doctor would push a statin would hopefully decrease a little bit. Her inflammation, big time drop, 15 to 5.8. So big change there. Fasting glucose, 312 to 183. Huge, but you could say, well, that's fasting, and that was a one-time look. So, you know, is it valid? So, well, let's look at her video. 9.6 in the A1C to 7.5. So big time drop, okay? In just 6 weeks. So we know, first of all, with one reason we test objectively is so that we can say, hey, look, here's where you were, here's where you are. We can also show other medical professionals so they know. But specific to her case, and a person who says, hey, I don't believe I can do it, it's like, well, look what you did. I mean, you've made massive change and you're trending the direction we want to go. So it's awesome to be able to see results like that. Liver inflammation decreasing, so getting rid of the driver to the fatty liver. And look, TSH was lab high before, diagnostic for hypothyroid. Now it's almost optimal range. Optimal range is 1.8 to 3. She's at 3.09 at the 6 week mark. So metabolism improving, which allows her to function better, feel better. Urinalysis, pre and post, so no sugar in the urine anymore. And the UTI essentially gone. So what questions do you have on that case? So for her, modified ketogenic diet was the right answer. If we had done, say, paleo, she probably wouldn't have got there, because there's lots of still carbs allowed in paleo potentially, and in today's world, like, there's paleo cookbooks that are all paleo brownies, paleo cupcakes, paleo, you know. So she would have chosen the paleo donut. It wouldn't have really helped. You know, so you have to be specific to the person. So let's talk about Wyatt. Wyatt's a 12-year-old boy with Crohn's disease and failure to thrive, which failure to thrive basically means not putting on weight, not developing like a 12-year-old third grader should. So when he came in, he weighed 68 pounds. He had a grayish look to the skin, you know, unhealthy look. And he had been diagnosed with Crohn's disease, and basically the medical doctors told him, you have to be on a liquid diet for the rest of your life, which was Ensure for him, okay? Ensure 3 meals a day. And you're going to be on medication, so antibiotics, steroids, EpiPen. So for a 12-year-old kid, that's not a good quality of life. Making it even worse is he would come home from school and spend 2 hours every single night on the toilet, like straight. Stomach pain, diarrhea, Crohn's, okay? And obviously that affects his mood and his affect and his ability to enjoy life and, you know, communicate in a happy way. So these are all things that mom and family didn't want for him. So we said, well, let's see what's under the hood. So for him, Crohn's is an inflammatory bowel disease, so obviously we want to look at gut there. One way that I kind of practice is I don't want to assume that any diagnosis is correct until I can prove it to myself, because I've had multiple patients that walked in with a label that never had the actual work done to fit the diagnostic criteria. So I want to prove that one way or the other, so that if you're calling yourself something, it's at least correct, okay? So I wanted to make sure Crohn's was actually there. And so Citrobacter is a brick thrower that is associated with inflammatory bowel disease, so we know that can drive it. These inflammatory markers here help protect and is the marker for gut inflammation. If you're 200 or above, you really start to think about inflammatory bowel disease. So Crohn's, ulcerative colitis, celiac disease. Okay, so he's at 452. Lactoferrin, normal is less than 7. This is 700.
okay? And then lysozyme less than 600 is normal, he's 1750. So basically there's this inflammatory soup, inflammatory bowel disease known as Crohn's going on. In his blood, his hemoglobin A1C, or his video for his blood sugar, is lab high, so pre-diabetic numbers. So why would that be? Yes. You ever read the label of Ensure or Boost or any of those? High fructose corn syrup, all kinds of junk. So he's got a liquid diet and he's driving himself diabetic, and that was what was recommended. Okay, that was the diet recommended. Is uric acid lab high? Again, that could be a gout driver, but it's also a big time inflammatory driver. And his platelets are lab high. Platelet is a non-specific indicator of high levels of inflammation. And so he's got an inflammatory bowel disease. He's constantly being triggered here, pulling that fire alarm, systemically inflamed. So basically what we did, I'll tell you what we did after this. So there's his pre. At 3 months, his A1C dropped to 5.2. So now we've established normalized blood sugar for him, which is huge. Okay, and part of the way we did that is we got him off a liquid diet. We got him on food, okay, and a specific diet that we'll talk about. His uric acid went from 6.7 to 6.4, so no longer lab high, functionally high, and we're working on getting that inflammation down. His platelets from 512 to 353. So again, lab high down to functionally high. So, we have a tendency in our society to want to look at lab work and be like, it was this, now it's this, and it's over. But remember, we're dynamic. Like every second, there's physiology going on. So it's more about where is he trending. So we can see that the inflammation is decreasing, heading in the right direction. Stool test, brick thrower is gone. Arrested all of them. Okay, so all the windows are safe now. So remember, Citrobacter was a driver for inflammatory bowel disease. So we've eliminated that microbial driver. His calprotectin down from 452 to 93. So not even at that inflammatory bowel disease level anymore. Lactoferrin dropped from 712 to 122. Lysozyme 1700 to 1000. So again, where's the inflammatory status pointing? Big time drop and pointing the way we want it to go. So Crohn's disease can be considered an autoimmune disease, and in 2018, where we are right now, we do not know how to cure autoimmune disease, okay? Regardless of what a Dr. Oz show or a best-selling book will say. Autoimmunity is immune-based, and it means you've created memory cells in your immune system that remembers your self-tissue as a target, okay? So we can't say we've cured it until we've totally erased those memory cells, and we don't know how to do that yet. So the clinical goal for autoimmunity is to decrease symptoms as much as possible and have as much time between flares as possible, right? We're humans, so flares are probably going to happen, because even if you're doing everything right that you control, you still walk out and, there's a nuclear power plant not far from here. There's all kinds of environmental things that can trigger us. So from an autoimmune perspective, I'm not going to stand up here and say we cured his Crohn's disease. But what we did is we've driven it towards dormancy, okay? And we want to keep it there for as long as we can. So that's great. We have objective change. What about subjective changes? Quality of life. Quality of life, he put on 20 pounds in the 3 months. So from 68 pounds to 87, 19 pounds. But since then, he's put on more. He's over 100 now, okay? His skin looks like skin, not gray. So he's healthy. He's no longer failure to thrive. He's developing and catching up, caught up normally to where a 13-year-old should be. And so what we did from a diet standpoint was we used a specific carbohydrate diet with him. That's important for inflammatory bowel disease because of how digestion works. So in the small intestine, if we zoomed in on your small intestine lining, it would look like this. And this is called the brush border. Okay, so it's like little bristles here. And what the bristles do is they increase surface area for absorption of nutrients. And they also will produce digestive enzymes to finish the final step of digestion. So if you have a steak on your plate, that's protein, right? Down here, it's broken down to the individual amino acids and can be absorbed. If you have bread on your plate, that's a giant lump of carbs. Down here, it's down to, say, monosaccharides or disaccharides, so the smallest bits that can then be absorbed. Well, in Crohn's or ulcerative colitis, celiac disease, that brush border looks like this, okay? So we've lost all that surface area for absorption, and we've lost those digestive enzymes to help finish the job. So those small bits are now inflammatory triggers, okay? So in the specific carbohydrate diet, we're eliminating all carbs except for the carbs small enough to just pass through via passive diffusion. They don't require any of this help, okay? And we eat that way long enough to grow these back, and then now we can reintroduce carbs that, normal carbs. So his diet looked a lot like bone broth, aloe, soups, steaks, that sort of thing, but avoiding the carbs that would trigger inflammation in the gut lining and the Crohn's. Make sense? So for him, a modified ketogenic diet would have not been helpful necessarily, or as helpful as this would have been. Paleo wouldn't have helped him at all because he would have still been eating carbs and triggering that. So it's more about who's the person in front of me and what's the diet that works best for their specific case where they are right now. And that answer might change 3 months later when he's got brush border back and now change it. So now he eats sweet potatoes. Now he's reintroduced foods because we've achieved the healing necessary to do that. So again, you can see that testimonial on the website or on the YouTube channel.